I'm Caroline, I'm 26 years old and I study social work in Frankfurt, Germany. I also have chronic pain and axial spondyloarthritis. I probably already had it very early on as a child, but we first started looking for a diagnosis when I was 14 or 15 years old. For me, that sadly was a big struggle. I had doctors tell me that I'm not sick and the pain is just in my mind, or that I would fake it for attention. 6 years after the start of my diagnosis journey, for a doctor to look closer at my back. At this point, you could already see evidence of past inflammations in the x-rays of my lower back. I'm really glad that I finally have the right diagnosis, but the challenges didn't stop there. I still had a long way to go to figure out the right treatments and medications, and honestly, I think that will never stop. My RMD keeps evolving and changing, but so does medicine, so it's important to stay up to date and informed.
If you have rheumatic and musculoskeletal diseases, you know how challenging it can be to find trustworthy information. The complexity of the rheumatic conditions, the abundance of information, and the involvement of various stakeholders, each with their own intentions, can make it challenging to determine what is trustworthy. I'm Uta Kilz. I'm working as a rheumatologist in Germany. As chair of EULAR's Quality of Care Committee, I'm responsible for the development of EULAR recommendations.
In the beginning, I heavily relied on my doctors and my mom, who is a health professional, for any information about my RMD. When that didn't answer all the questions I had, I started to look online. But there's a lot of different information out there and it's hard to know what you can trust.
On top of that, the rapid evolution of knowledge in rheumatology adds to the complexity of staying informed. In addition, many rheumatologists and other healthcare professionals are still not fully aware of the EULAR recommendations. Recommendations present relevant evidence to help healthcare professionals and patients weigh the benefits and risk of different procedures, treatments, and opportunities. These recommendations are designed to improve patient care, but they can only make a difference if they are used.
I'm Corinna from Germany. I've been living with my diagnosis of rheumatoid arthritis for about 34 years. If I remember the time of my first diagnosis, we were a small young family with a baby. My husband and I were both musicians and had lots of musical plans. Nobody believed me that this young, amazing, strong woman could have a serious chronic illness. At least of all me. I used to struggle with understanding what was happening to my body.
In my practice, I've seen firsthand how crucial access to accurate information is for people with RMDs. When patients are more informed about their condition, they are better equipped to play a more active role in shared decision-making and, as a consequence, can better manage their health and well-being. I'm Xenofon Baraliakos. I'm a professor for internal medicine and rheumatology and the EULAR president-elect.
My national organization was a lifeline, enabling me to find relevant information to understand what was wrong with me and peer support at the time that I needed support the most. I was finally able to ask all my questions, received evidence-based information, and was part of a community of RMD patients who could exchange experiences, laugh together, and overcome many difficulties.
In addition, EULAR helps to empower patients and their support networks to be more involved in shaping healthcare research and services through a range of voluntary opportunities, mainly overseen by the EULAR's PARE committee. Examples include the Patients Research Partners online course, best practice webinars, podcasts, the EULAR PARE conference, and the EULAR Annual Congress. Patients' contributions to research on RMDs are invaluable, providing unique insights and real-world perspectives that enhance the relevance and the impact of scientific studies. Their active participation, engagement, and involvement in research initiatives helps shape more person-centered approaches and drives innovations in treatment and care. Through the efforts of patients and other experts in the field of rheumatology, EULAR continues to bridge the gap between medical knowledge and patient understanding, fostering a world where information empowers and transforms lives.
I love the EULAR podcast. It's a super easy way to get that feeling of community and that you're not alone with the things you experience. I also really like the EULAR webinars. It's an excellent opportunity to learn more about all kinds of approaches, resources, and possibilities that maybe you otherwise wouldn't know about, and a great starting point to connect with other patients.
Healthcare professionals have a critical responsibility to be informed about latest recommendations and to share them with their patients. EULAR is dedicated to empowering healthcare professionals and patients with reliable and up-to-date information. The lay summaries of recommendations simplify complex information, making it accessible and understandable for non-specialists. By continuously updating these resources, EULAR ensures that rheumatologists, healthcare professionals, and people living with RMDs stay informed about the latest developments and best practice in rheumatology care.
I have gained a lot of experience volunteering with my national organization, and I'm very happy to be involved in the EULAR PARE community. So I'm able to help to provide information, guidance, and support the whole rheumatology community, including patient organizations. As well as lay summaries of recommendations, I've had the opportunity to be a patient research partner, speaker at the annual congress, and much more, which has broadened my understanding and enabled me to be a stronger advocate for myself and my fellow patients. Ultimately, I'm also in a much better position to understand my illness, to utilize my treatment options, and to talk to the doctors on an equal footing. Shared decision-making is no longer a foreign word.
Connecting with my national patient organization impacted my management of my RMD because I learned how to advocate for myself. I had access to reliable information in a language I can understand easily, but most of all, I became part of a community that can understand my struggles in a way other healthy people can't. That feeling of empowerment and understanding really helps if sometimes you struggle through your daily challenges. And I learned how being informed improves my health outcomes and can influence my treatment course. My voice matters, and I decide what happens to me and my body.